Hi, my name is Dr. Karl Anderson. I'm a dentist in St. Paul. Oh, I'll tell you what, and when I went to see Dr. Cooper, I was really frightened. My mother died of Alzheimer's disease, and all of a sudden I was having extreme brain fog. I was having issues with just remembering my grandchildren's name. I'm looking at one of my grandsons, and I couldn't conjure up his name. That scared me. I had to be working on a patient in a chair, dental chair, and in the middle of the procedure, I forget what their name was, and I'd have to be glancing over at the computer screen to, maybe give myself a reminder of who I was working on. I'm also a naturopathic dentist, basically, and so I understood toxicity, and I thought, well, I checked my mercury levels. I was not toxic with mercury. Everything else, my parameters seemed to be normal. And so when I found out Dr. Cooper was practicing neurological health and with this functional medicine practice, I went to see him immediately. So I was very aware of good nutrition, the effects of that, toxicity and the effects of that. And so I've studied intensively in this area and counseled many patients in this area for years. So physically and supplementally, I was doing well. I exercised a bit, never extreme, but continued to get physical exercise. All those things that I had been doing over the years, and have done well with that up to a couple of years ago before I saw Dr. Cooper. I didn't have a shortage of a drug. Okay, I don't need a drug to improve my situation. But I needed extra help in the functional medicine arena because that's an area I haven't studied intensively, although I have read many articles and read a few books basically about functional medicine, and I believe personally that that's the form of medicine that I want to have done on myself. And we sat down and we did a very thorough consultation. I was pretty impressed with the thoroughness of the neurologic exam, and the testing that he ordered on me was, I thought at first, a little bit excessive. But when we sat down for the consultation to explain what the situation was, I was very impressed with his knowledge base of this area, and he zeroed in right away what my problem was, which was previous trauma to the head that has caused some brain damage, and the fact that I was eating certain foods that were causing a lot of inflammation within my system. Mm-hmm. And so he laid out a plan for me, a 6-month plan, and we started that program. And in fact, my wife came to the clinic also, and in fact, she's gone through his program. We both had excellent results. A variety of exercises to try to retrain my right brain to my left brain. I was having a disconnect there, but the main things were dietary. I'm one of these people that had some kind of gluten insensitivity. I never had any indication of that prior to this. I ate any food, never had disruption in my bowel or my gut. I never had problems that way. But when he showed me conclusively the Cyrex testing that showed that I had certain things I was extremely sensitive to, possibly allergic to, and we cut that out with the detox diet, within 2 weeks, basically, I was back to feeling functionally, my memory was back within 2 weeks. Then over a series of 6 months, I saw him on a weekly basis, and he basically retrained my right side to connect with my left side. So now I can hop, skip, and jump. And Daryl, I'm sorry, but I still can't dance. But I couldn't dance before. Just been feeling fantastic. In fact, it stimulated my wife and I to both move on, and now we're working with a personal trainer, doing some bodybuilding exercises, strength training. And so we both, at this point, we had a conversation about a month ago, but basically that the money that we spent with Dr. Cooper was the best money I've ever spent. The worst healthcare in this country is free healthcare, or what your insurance may cover. I have this discussion with patients all the time. Insurance companies aren't in the business to make us healthier. They're in the business to make money, okay? I would behoove a person to really consider that, you either do this at your stage of your life and get your health in order, or you're just not going to have a very good end of life. I'm in the other half of my tail end of my life at this point, and in the best shape that I've ever been. Feel physically more alert, physically more stamina, physically the best I've felt in years. And that's how I'd like to approach old age. I mean, I have no desire to retire and not be able to enjoy my retirement. And so it's given me a whole new lease on life.